Here I am, locked inside my own little world. You don't understand. It's not my fault. It's the way I am. I wish I could say what I want, but I'm autistic, so that kind of gets in the way. Susan Logan. Today I'm here to inform you about a developmental disorder known as autism. According to the article Importance of Autism Awareness, Understanding, and Acceptance, published in October of 2020, Nala H. reported, when you teach neurotypical children about autism awareness, acceptance, and appreciation, they fearlessly lead the way in embracing, respecting, and supporting children with ASD. Improving awareness and empathy is about creating a greater acceptance of children or adults with autism. Today I will be talking about what autism is, how it's like living with autism, including the family's perspective, and the status of the treatment. Autism is a developmental disorder of variables that is characterized by difficulty in social interactions and communication and by restrictive and repetitive behavior. There are 3 types of autism in the autism spectrum, which is the autistic disorder, the Asperger's, and the pervasive developmental disorder. Autism is not genetic. It cannot be passed down from generation to generation. And it cannot be medically tested, which makes it hard to diagnose. Like, you can't actually get blood tested and then they can't tell you like, oh, you have autism. That's not the way it works. Instead, doctors have to look at a person's developmental history, and it also has to look at their behaviors in order to diagnose someone. According to the website Autism Speaks, published in 2013 by the CDC, autism affected an estimated 1 in 54 children in the United States today. People with autism have problems in social, emotional, and communication skills. Some may repeat certain things. Many kids with autism cannot maintain direct eye contact with the person. They normally look away within a few seconds. Many of the abilities that we are able to do without even trying, people with autism struggle to do. Like, some of the things that we do without even trying is like communicating, talking to people, and people with autism tend to have complications with that, and they get frustrated and they become more irritable. Autism can affect a person's life in many ways, but that does not mean that a person cannot have a normal life, which is truly amazing. According to the article, can a person with autism in the autism spectrum disorder live an independent life, published in October 2020, the simple answer to the question is yes. A person with autism spectrum disorder can live independently as an adult. However, not all individuals achieve the same level of independence. The focus of the intervention service is to help the individuals achieve their highest possible level of independence, and that won't look the same for everyone. Some families may struggle with dealing with somebody with autism, but as they get older, things do get better if they have interventions. This is because if they get interventions and they get help, the better they will be at communicating and dealing with their developmental disorder. There is no cure there, and one day there will be. But some interventions that can help include behavior and communication approaches, dietary approaches, and medication. There are many types of behavioral and communication approaches. Some are applied behavior analysis, discrete trial training, and many more. Many of these have shown positive results in patients with autism and help improve their behavior. There's also therapy like occupational therapy, social skill training, and speech therapy. I have personal experience with speech therapy because at school they give the children with autism speech therapy, and it helps them improve their communication, pronunciation of words, and etc. According to the article Autism Spectrum Disorder, published on September 2019 by the CDC, the difference in how ASD affects each person means that people with ASD have a unique strength and challenges in specific social and communication behavior and cognitive ability. Therefore, treatment plans are usually multidisciplinary. Many of them involve like a parent's opinion, and each treatment is targeted for each individual child. Like, the therapy is never the same for every single child. which means that all the treatments, some treatments may not work for some children, but you should still give the treatments a shot. So today I have talked about the mental disorder known as autism. I have also informed you about what autism is, how it is living with autism, including the family, and the treatments that they have come up with this far. Just remember, when you see a person with autism, they just see the world from a different angle. Thank you.